Sometimes I get asked about the spinal stenosis. This seems to be somewhat of a confusing diagnosis for a lot of folks. Stenosis is simply just any tightness around the nerves. A lot of times this is caused from a disc bulge or disc herniation. A lot of times arthritis can contribute to this, even thickening of the ligaments. A lot of times it's all three of these factors. So again, stenosis is just any kind of tightness around the nerves. Usually it doesn't come on overnight. Typically these are more degenerative changes, stuff that's been going on gradually for years, if not decades. A lot of times you get to a certain point where basically there's a degree of tightness around those nerves where the nerves become symptomatic. You develop numbness, tingling, weakness typically. A lot of these symptoms are more intermittent in nature, but all those symptoms signify some kind of irritation because of usually tightness around the nerve. So treatment options for that, most of the time things get better on their own. So the vast majority of people, things get better on their own regardless of what we do. However, we do have treatment options to basically buy you some time. In other words, options to make you more comfortable while the body kind of calms itself down. Typically this involves therapy to work on strengthening the back. A lot of times stenosis can be exacerbated by postures that are not perfect. Whether you're bent too far forward, typically you have a weaker spine, you're carrying yourself different, all of those can exacerbate spinal stenosis type symptoms. Beyond that is medications. Those are more to kind of calm the nerves down. Usually that involves anti-inflammatories or even kind of medications we use for nerve pain that are non-habit forming, such as Neurontin or Lyrica are just two examples. Beyond that, injections play a fairly large role in stenosis. As long as the stenosis or tightness is not very severe, usually injections do very well. What the injections do is basically put a strong anti-inflammatory medication right around where the nerve is getting squeezed, and this decreases inflammation and swelling. And the idea is that no, the injection does not take away the tightness, but if we can get that nerve happy again, then you'll be feeling better and hopefully you'll be cruising. If you are experiencing symptoms of stenosis, please call our practice and we will be more than happy to set a treatment plan in place for you.